Well, at the Acute Leukemia Forum 2019 this year, there were a number of very exciting presentations. The regimen of hypomethylating agents or low-dose cytarabine plus venetoclax, recently approved regimens for the treatment of older adults with AML, has become a very popular and very effective regimen. And there were several presentations, one by Dr. Craig Jordan from the University of Colorado, who talked about potentially why this regimen is so effective. And one reason may be that we now have a regimen that looks like it may eradicate the leukemic stem cell, the initial initiating cell. So I think that was an important presentation. Another presentation was by Dr. Courtney DiNardo from the MD Anderson Cancer Center, who followed up on Dr. Jordan's presentation and talked about a lot of the clinical data and talked about novel agents, in particular HMA and venetoclax, which, as I said, is emerging as a very popular regimen. Dr. Larson talked about consolidation chemotherapy and addressed some of the older studies that resulted in our current regimen of giving high-dose Ara-C. And he made the suggestion that we may get along with less high dose, with a more modest dose of cytarabine, may be quite as effective. But other than that, there didn't seem to be major changes in our ability to administer consolidation chemotherapy. Dr. Applebaum talked about the ability to deliver maintenance chemotherapy after allogeneic transplantation. One of the major problems with transplantation is relapse after transplantation, and we now have a number of agents that we can test the ability to deliver maintenance therapy as a way to prevent relapse. 5-azacitidine is a popular drug that has been explored, but in a recent randomized study, small randomized study, there was a suggestion that 5-azacitidine post-transplant was not more effective than not giving azacitidine. There are a number of other agents, targeted agents, FLT3 inhibitors, IDH inhibitors that I think will be tested. But as of today, Dr. Applebaum emphasized that there is no clearly effective post-remission maintenance therapy after allogeneic transplantation. Dr. Rick Jones from the Johns Hopkins University Medical Center talked about post-transplant cyclophosphamide after haploidentical transplantation. And he indicated that this maneuver now of giving post-transplant cyclophosphamide has really diminished graft versus host disease and has improved transplant-related mortality. And so I think that has made a haploidentical transplantation a much more effective form of transplantation. Dr. Jamie Ferrara from the Mount Sinai School of Medicine in New York City talked about the pathophysiology of graft versus host disease and suggested that we may be on the verge of making some impact on our ability to treat graft versus host disease. So I think those were some of the major highlights of the meeting this year.